First thing I tell guys is you're not going to go to a gas station, get a pill that's going to make your penis 6 inches longer. So there is a lot of false advertising out there. Yep. But I think it's a good conversation. You know, when we're talking about penile enhancement, there's a lot of things that we can talk about. I think the main conversation comes down to girth enhancement, right? Which is a little bit different.
Yeah.
And length enhancement. I tell guys all the time, if I can make your penis 6 inches longer, I'd be a billionaire. I wouldn't be doing this anymore. But, you know, so there's certain limitations of what we can do. You know, we'll talk a little bit more in depth about kind of girth versus length enhancement. But what do you usually tell patients is the difference?
Hello, YouTube family. It is your girl, Dr. Fenwa Milhouse, board-certified urologist, your favorite urologist, Dr. Down Below, co-founder, co-CEO of Down There Urology, with my other half, the Dr. Jagan Kansal.
Good to be back. Dr. Kansal, I don't have as good of an introduction, but glad to be back and doing some more education today.
Absolutely.
Yep.
So I think both of us do penile enhancement, penile girth enhancement, penile fillers. I think we get a lot of individuals asking us about other ways to enhance their penis. What is real? What is fake? Yeah, so I tell them the same thing. I tell them it's a lot easier for us to increase your penis like this way than it is, you know, lengthwise. And that if it sounds too easy to be true, it is too easy to be true. Okay, right? Everybody would be signing up. Whatever way it's that we have out there, it's either going to be a decent amount of money or take a lot of consistent time, okay? Consistency and dedication. So we have safe ways to enhance girth. We do tons of it with fillers and primarily HA or hyaluronic acid fillers. But these are safe because of their reversibility and the fact that hyaluronidase, which can easily be injected to undo it if we need to. Yeah. You only got the one penis. If you're going to enhance it cosmetically or aesthetically, you don't want to compromise function and you don't want to compromise form in a way that is hard to undo. Other type of fillers will require degloving the penis. You can explain with the audience what the heck that means.
Yeah, I agree. You know, historically, when we talk about girth enhancement, you know, there hasn't been a lot of great options, to be honest with you. There's been surgical options, right, that have been the pros and cons. I mean, they've worked in the past. The problem with surgical options is in order to fix any issues, it's another surgery, right? And the more surgeries you do on the penis, the more scar tissue. And then you go to the injectable routes, right? So they've been having fillers for quite a long time. The nice thing about the HA fillers, hyaluronic fillers, is that they're kind of a natural appearing substance in the body already, right? So you don't have like a rejection, you know, there's not like a big reactive thing that you can have a problem with for the most part. HA fillers, just HA in general, hyaluronic acid's in our skin, it's underneath our skin, yes. It's in our knees, it's in our joints, it's kind of natural appearing. And it's had a long testing period. I mean, for facial fillers, you can kind of go a little bit more into that, lip fillers, all that kind of stuff. You know, it's been something that's tested for quite a long time and people have been using it. Now we're just refashioning it to using the penis.
Yeah.
We've been doing girth enhancement for a long time. I've been really pleasantly surprised with the girth enhancement for the fillers. I mean, guys love it. And it's been a really good addition to what we can offer guys for girth enhancement. And kind of like what you were saying is like, it's adjustable.
Yes.
You know, it's not something that you do surgeries, do it once and it's there forever. You know, you can get it bigger, you can get it smaller, you can do whatever you want in that aspect, and it's very natural appearing, which is a big part of it.
Yes.
And you can really naturally kind of gain girth in a sense, where it looks really natural. And that's the experience I've had with my patients so far.
I have had patients tell me how much their partner loves it.
Yeah.
Too. To the point that I've had some patients that I'm like, oh, we can stop now. Like, we're good. And they will tell me my partner's insatiable. My partner is like so obsessed. Back to what you were saying, it is nice to have that safety net in the reversibility and the customizing, the lengthiness of us using HA fillers in other cosmetic. And yeah, so that's great. I mean, I wish it could enhance length as predictably as it does girth. I tell my patients, I can predict your girth. I cannot, HA fillers. Lengthening is a different thing. A lot of patients' penises will not lengthen. Some will. They hang more, they're heavier.
Yeah, I kind of agree. You know, the filler is primarily made for girth enhancement. I've had a number of patients that do get length. It is heavier. There are protocols that we have to do that stretching therapy while we put the filler in and that kind of stuff. And so I do think that helps. Length is a hard thing to get. You know, you're born with what you're born with, but there are ways to try to improve that. So the first question I get, a lot of patients are coming in for, you know, enhancement the size of the girth is, are there any surgeries for lengthening?
Yeah.
To be honest with you, there's not many that I would say I love.
Not ones you would sign up for.
And you know, we've talked about release of the suspensory ligament. You guys might have heard of that a little bit. You know, you're not gaining a lot of length with that procedure. You know, I think there's not a lot of surgical options is the kind of the summary of lengthening stuff.
Have you ever heard of those sliding, like sliding techniques where they put these like jagged cuts?
Yeah, there is a sliding technique where you can try to get length. So the idea is your penis is made up of 2 cylinders, right? And they have a certain amount of length to them. In order to get the penis to be longer, you have to expand those cylinders as much as possible, right? Surgically, you can kind of increase the length of that cylinder by, you know, you make these small cuts in certain areas, and you can kind of actually lengthen the cylinder just like any other mechanical stuff. You can lengthen the cylinder by making certain cuts in certain areas.
Yes.
It is not a surgery I would recommend, to be honest with you. There are a lot of complications from that surgery. It can absolutely affect your erections.
Yes.
And so just to kind of summarize, there's not a surgery I recommend for length.
Correct. And that's not just you, by the way. That's endorsed by the Sexual Medicine Society of North America as well.
Absolutely.
They don't recommend any surgical and lengthening procedures except for in like a study protocol.
In general, the way the anatomy works is 50% of the penis is outside the body, 50% is inside the body, right? And as time goes on, people say my penis is shorter, but sometimes their body habit has changed, right? They have more fat, that kind of stuff. And so now 30% is outside the body, 70% is inside your body. So there are some procedures you can do to change that ratio.
Yeah.
So, you know, let's say you've gained some weight and you have something called a panis, right? Oh, that's kind of covering up half the penis. You can do a peniculectomy or removal of that suprapubic fat pad.
Right there, yeah.
And that can increase the external length of your penis, and guys do that, but that's not a true lengthening procedure per se, but that does increase the length of your external penis. So that is a possibility. So stretching the penis on a consistent basis can get you length, okay? But it's not an overnight thing. It can take months and months for that to work, but if people are willing to do that, I think stretching is a great option. What do you think about the difference between vacuum pumps versus actual traction devices? Do you have any thoughts on that?
The vacuum pumps allow for blood to circulate, you know, to get into the cavernosa and to fill the cavernosa, but it doesn't inherently put it on traction or tension or stretching. The real lengthening, if you want to gain inches, want to gain, you know, a length, is going to require weights or some sort of traction over the vacuum pumps. What do you feel?
100% agree with you. I usually tell guys vacuum erection pumps are great for functional.
Yes.
Penile rehab is what I call it.
Yep.
So, you know, the way vacuum pumps work is negative pressure, right? You're kind of forcing blood. And I do think it helps kind of open up vessels and kind of get that bump. And I think it's good for that rehab where you're kind of getting the cylinder stretched out, right? Yes. So if you're not getting good erections, it's a great way to kind of get those cylinders stretched out so you don't lose that elasticity of the cylinders. I think guys, and everything in life is moderation. I think guys that do it too aggressively and too vigorously and too long, I think you can have some damage to the vessels. People ask me how long you should do it. It depends on what the reason we're doing it for. So if you're just doing it for penile rehab, I'll tell guys, put the vacuum on for 10 minutes kind of thing.
Okay.
Keep it on there, do it a couple times a day. But I agree with you kind of in the original point is that you're not overly extending it with those pumps.
Yeah.
You really need that traction device is what we use. Weights you have to be a little careful of, you know, in that sense, but traction devices are very good nowadays. And there's one specifically made for penile traction therapy that can give you more length.
So yeah, I'm a big fan of traction devices. The weights, you have to be more careful. You know, any of these things are generally safe, but you can overdo anything. And if you overdo it, you like the rubber band analogy, you can snap. You said there's a particular device that you really like traction wise. Do you care to share it with our audience?
Sure. So there's a couple different devices out there on the market. You know, this comes from the Peyronie's literature that you're kind of talking about. So same thing in Peyronie's is you can actually help improve curvature with that consistent stretching. So we talk about that. Restorex is the one that we use a lot. It's a device developed by Mayo Clinic specifically for Peyronie's disease in terms of fixing curvature. To go back to your point of like how long do you keep these traction devices on? You know, I think it's for different indications, but ideally the longer you keep it on, the more you're going to get.
Yeah.
So we used to use these traction devices for like 8 hours a day. which is obviously insane.
That's insane.
But
Yeah.
it's like that kind of gets to the point of you need that constant stretching. If you do it for 10 minutes here and there, it's not going to make a difference. You need that consistency a little bit. You know, girth, you can come into our office in 20 minutes. We can get you whatever girth you want for the most part. Length is a process that takes time, and you may have minimal gains in the beginning, and it just takes time. So I generally tell guys length is not something that's easily changeable. Girth is based on what we have available today.
Again, if it's quick and easy and it's cheap, it's a scam. And I know I get patients who want to do the HA fillers but want to continue to do their traction, lengthening, and I'm okay with that. I think that they can safely do that. I do recommend that they have a period of rest between when they get the HA filler before they resume any kind of traction or pump. You know, we don't want that filler to migrate too much where we put it.
I agree. You know, week after we put these in, we don't want the filler to migrate, right? So I actually don't recommend pump. So I do think I am a fan of traction therapy after fillers for sure. It just depends on the timing of it.
Correct.
Yeah, I think the first week or so when it's trying to settle in, I don't do aggressive traction, but I do think some traction is totally
okay. Yeah. I mean, the penis is dynamic anyway.
Yeah.
So great conversation.
Yes.
Hope you enjoyed it. Please let me know by liking this video. Tell me your comments. I want to see that. So drop a comment. Make sure that you are subscribed. Duh. Why not? And join us every week for all things down there right here.